248 Aphorism Organon of Medicine. The dose of the medicine may be repeated several times according to circumstances, but only so long as until either recovery ensures or the same remedy ceases to do good and the rest of the disease presenting a different group of symptoms demands a different homeopathic remedy. Aphorism 248 is rewritten in the 6th edition as follows. For this purpose, we potentize anew the medicinal solution with perhaps 8, 10, 12 successions from which we give the patient one or increasingly several teaspoons doses in long-lasting diseases daily or every second day, in acute diseases every 2 or 6 hours, and in very urgent cases every hour or oftener. Thus, in chronic diseases, every correctly chosen homeopathic medicine, even those whose action is of long duration, may be repeated daily for months with ever increasing success. If the solution is used up in 7 to 15 days, it is necessary to add to the next solution of the same medicine, if still indicated, one or, though rarely, several pellets of a higher potency with which we continue so long as the patient experiences continued improvement without encountering one or another complaint that he never had before in his life. For if this happens, if the balance of the disease appears in a group of altered symptoms, then another, one more homeopathically related medicine must be chosen in place of the last and administered in the same repeated doses, mindful, however, of modifying the solution of every dose with thorough, vigorous successions, thus changing its degree of potency and increasing it somewhat. On the other hand, should they appear during almost daily repetition of the well indicated homeopathic remedy towards the end of the treatment of a chronic disease, so called homeopathic aggravations, by which the balance of the morbid symptoms seem to again increase somewhat, the medicinal disease, similar to the original, now alone persistently manifests itself. The doses in that case must then be reduced still further and repeated in longer intervals, and possibly stopped several days in order to see if the recovery need no further medicinal aid. The apparent symptoms, Schein Symptome, caused by the excess of the homeopathic medicine will soon disappear and leave undisturbed health in its wake, if only a small vial, say a dram of dilute alcohol, is used in the treatment, in which is contained and dissolved thorough succession one globule of the medicine, which is to be used by olfaction every 2, 3, or 4 days. This also must be thoroughly successed 8 to 10 times before each olfaction. Footnote: made in 40, 30, 20, 15, or 8 tablespoons of water with the addition of some alcohol or a piece of charcoal in order to preserve it. If charcoal is used, it is suspended by means of a thread in the vial and is taken out when the vial is successed. The solution of the medicinal globule, and it is rarely necessary to use more than one globule of a thoroughly potentized medicine in a large quantity of water, can be obviated by making a solution in only 7-8 tablespoonfuls of water, and after thorough succession of the vial, take from it 1 tablespoonful and put it in a glass of water containing about 7 to 8 spoonfuls. This stirred thoroughly and then give a dose to the patient. If he is unusually excited and sensitive, a teaspoonful of this solution may be put in a second glass of water, thoroughly stirred, and teaspoonful doses or more be given. There are patients of so great sensitiveness that the third or fourth glass, similarly prepared, may be necessary. Each such prepared glass must be made fresh daily. The globule of the high potency is best crushed in a few grains of sugar of milk, which the patient can put in the vial and be dissolved in the required quantity of water.